Welcome to the Sunstone Health Podcast, hosted by storyteller Justin Starbird and Josh Resnikoff, co-founder and CEO of TMA Precision Health. This podcast brings you inside the movement that's reshaping how we diagnose, treat, and care for patients who have spent years searching for answers. At the heart of it all, TMA's mission is to end the diagnostic odyssey through AI, data-driven insights, and expert human guidance. Here are your hosts, Josh Resnikoff and Justin Starbird.
Hey, welcome back to the Sunstone podcast. My name is Justin Starbird, and as always, I am joined by CEO and founder of TMA Precision Health, Josh Resnikoff. Josh, good to see you again, bud.
Yeah, good to see you too. I feel like we just saw each other a couple days ago.
And the day before that. I mean, this is becoming old hat to get to hang out and do these things.
Yeah, the panel was great at MedDevice, so it's really interesting to see how much this applies to different people in the rare disease space and the crowdfunding space. But yeah, happy to talk today.
Yeah, absolutely. And as am I. The first episode, we sort of dove deep into, how you got started and a little bit of the mission, what happened, to you and your family, and how, Shiloh was affected by rare disease, you going on this diagnostic journey. And it's so personal. That said, it also creates an incredible story for, the reason for the company. So, it's so neat to be able to dive deeper into this story.
Yeah, I think, we were just talking about this a little bit the other day. It's one of those things that, I've done the math, right? Like, 1 out of 10 Americans are touched by a rare disease. It's more than cancer and Alzheimer's combined. Like, you can see all those stats. But one of the most profound, touching things that has really come out of this WeFunder campaign that we've been doing is just how much of the community we can go engage with, and how personal so many of those stories are. It's really, honestly, the testimonials about like why people are investing have been awesome. They've been really awesome.
Yeah, it's been neat to be just a small part of that, and what I want to talk about today, or what we are going to talk about today, is we got into the personal side of what led to TMA, your journey, how it affects your family and others, but we also touched a little bit on how you get involved. And initially we talked a little bit about who you work with, the self-funded employers. Can you walk us through that decision on that group, and what led to identifying those sorts of groups as who would be best fits for what TMA provides?
Yeah, just how we navigated our way to focus on them as our customer segment.
Yeah, absolutely. So way back when we were starting the company and looking at the opportunity, and really looking at the best way to make an impact for patients, right? I think most people, and you see this through work at Nord, you see it through Global Genes, you see it through so much patient advocacy. Most people, when they get a diagnosis, they go off and they start a patient advocacy group. They form a nonprofit. Maybe they're going to try to make a drug. Maybe they're trying to create awareness. It is a huge undertaking. They're doing God's work, honestly, to like find families and pull them together and make that support. I didn't want to do that. I felt like the space was really crowded. I didn't want to be out every year asking people to contribute to something that you have to keep them invested and involved all the time. So that was the first thing. Like, do we make a nonprofit? No, that's not the way we want to go. All right. Then when we're making the business, I think, again, most people, when they look at that, they're like, oh, well, I'll go do the point of transaction. And that's the doctor. You want to go sell to a provider, right? We talked to a few hospital systems early on, and it just very quickly became apparent that they were going to be giant pains in the asses to work with. Like, I'll just call it what it is. Like, you have a lot of really highly trained people who think they can already provide the solution that your company is trying to bring to patients, even though they're clearly not providing that, right? And most health systems are operating maybe on a good day at a 3% profit margin, probably more in like the 1% area. There's not a lot of extra money for them to bring. Then you got to onboard and yada, yada, yada. You also have to staff like an entire army of representatives to keep yourself present in that doctor's mind while they're managing 1,000 other things a day. So that felt like a big mountain to climb. And really, if you do just a structured analysis of like who buys what, who buys things, people with money buy things. Well, who has money in the healthcare system? It's insurance, right? We all hate them for it, but that's the truth. That's who has money. So, very quickly you should be able to define your market segment. And for us, that meant that if we wanted to scale a solution for patients, we had to make it make money or save money for insurance. Okay.
Yeah, you always make that point. I've heard you say this a couple of times now, especially in the MedTech healthcare space. In order to be successful, you have to identify what your product or service solution does that is going to make somebody money or save somebody money.
Yeah, it's, I think most of us, when we start, especially scientists who are notoriously not the best business people, right? We get a little bit of like first person blindness in this thing. Like, hey, I've created the best solution for a knee replacement. I've created the best solution for a new chemotherapeutic. But it doesn't really matter how good your solution is. Like, there are thousands of examples of things dying on the vine, as we say in the business, because they can't transact commercially. They don't make sense. And so anyone should really do a commercial analysis. Go talk to your MBA friend. Go do one yourself. Go ask GPT how to do it. But you need to figure out how the market works so that you can drive into a market opportunity, not into a solution opportunity. There's lots of great solutions. If they don't, we live in a capitalist society. If they don't make money for somebody one way or the other, they're not going to scale. Just full stop, right?
Yeah.
So,
Go ahead.
Go ahead. No, go ahead.
Well, I was just going to say, you call that the financial unlock, and, making insurances, companies, do the right thing. This is that ability to be able to translate, from what you've created to somebody making money.
Yeah. Well, look, I mean, again, right? Like if I'm buying dish powder, it's because it makes my plates cleaner in the dishwasher, right? Like that has a value to me, but you're selling it to me to create that value. If you're selling something to an employer, it better do something better for their members than whatever status quo is. But to displace the existing thing, it also has to do secondary function, which is either save them money or make them money, right? And especially for commercial insurance, which is where, and I'll come back to like how we got into the self-funded market, but commercial insurance is notorious about considering lives at an actuarial table for how much money they will cost over a certain amount of time. And for commercial insurance, and that's your big guys, your United, your Blue Cross, like the people who are fully insured, the sort of rule of thumb is if you can't make them money or save them money in an 18th, maybe a 24-month time frame from when your product is offered to their members, there's no conversation to have because their member rollover happens so often, right? Employers switch plans or whatever it is, that they don't think about the lifetime health or the lifetime value of a patient beyond really a 2-year horizon. Maybe you can find one that has a 36-month horizon, which becomes really challenging for anybody who's got a device or tech or anything like that even if you can save them money, you can't save them 1%. That's not interesting. It's going to cost them so much money to onboard your service, and your utilization rate is going to be low. Like you start to run the numbers, and all of a sudden they're like, well, it might cost me $9 to save $10, and that's not worth it for me, right? You really have to set up some significant delta between what it's currently costing them and what it could be costing them by using your service. And rule of thumb I've heard is about 20% is where it starts to get really interesting for them. All right.
Yeah.
Which is not an insignificant nut to go find, right? Like that's a lot of money.
And in this space, that is a significant disruption.
Yeah, it would be. But like, you're also, you have to battle against like the devil they know. You know, you might have legacy systems, but like they're fully integrated, right? How much is it going to cost for me to claw those things back out? Like there's all these other pressures on your system to becoming a commercial success. You could have the best hip replacement, you could cure Lyme disease, but if you don't fit into this commercial thesis, it doesn't matter. It just doesn't matter, right? And so I learned all that through a lot of advisors, mentors, reading, you know, bumping into conversations where I got caught off guard. I learned a lot of it the hard way, a lot of it the good way. And so, but I still knew that insurance was really the people with the money. So those are the ones that I could track. It still made the most sense that we were going to fit into those people. So I just kept refining our product to fit inside that 18-month window, right? Which is one of the reasons. I mean, like doing the right thing for patients as fast as possible is definitely our mission. Yeah. But when we hit that 12-week mark, and we can bring that 12-week mark down as we increase automation and vendors get faster and all that sort of stuff. But that let us go give 60% savings on those patients back to insurers in that 18-month window. And all of a sudden that became a really interesting conversation for commercial insurance to have. Great. All right. I'm like, great. I unlocked it, right? No. So then you come to find out.
Well, that was just the beginning, right? I mean, so
yeah.
we mentioned, or we've talked about, I don't remember if it was on the first episode or elsewhere, but we've talked, because you and I get to hang out a lot lately. We've talked a lot about the economy of the rare disease within the insurance world and how much that patient costs to the employer that's paying for those insurance. Talk a little bit about those economics.
Well, I will. I want to. So we like started with this idea of commercial insurance, but the problem with commercial insurance is that even for Blue Cross Blue Shield right now, the average I've heard is it takes 700 days to get to a contract with them. That's not to get through contracting. That's to get from first conversation to a contract. So it's 2 years. So the joke is you actually have to raise biotech money to even in med device, right? And like those numbers don't work. So I was questing, right? Trying to figure out how to like, you know, I'm knocking on doors, I'm working my network, how do I get in front of the right buyers, all this sort of stuff. And I had an advisor, Christina Waters, who used to work with this woman, Lena Chyhorsky at World Economic Forum. And she was like, I think you should meet. And Lena, and this is credit where credit is due, Lena is part of a consultancy called Alva 10. They are a diagnostic accelerator. Lena has become one of the national thought leaders on precision medicine for self-funded employers. And we're going to have her on at some point. I'll let her tell her own story. But suffice to say, I brought them on as consultants for a really great incentivized partnership. And she started showing me the self-funded employer world, right? And the opportunity that existed there and making some really great introductions for me. But everything that exists in the commercial insurance, that 18, 24-month actuarial table, does not exist either at all or nearly to the same extent in the self-funded. These employers want to take care of their members. Employers want mom and dad to be healthy so they show up to work on time. Yeah. Employers are they want an incentive package that makes them competitive in the marketplace, right? And they want to control costs as much as possible. And so all of a sudden, you know, learning from Lena and learning about the self-funded employer space, the value prop that we offered became a lot stronger for this customer segment.
Yeah, I mean, and that is incredible to be able to, you know, find that and not just identify it, but then act on it. So what was the next step for you, you know, in terms of like, now you identified them, how do you go about, you know, getting in front of them and you know, sharing that story?
I mean, that's just traditional marketing, right? You like put your boots on, you go pound the pavement, you knock on doors, you start sending out emails, you work your network. You know, Lena has a lot of cachet in the space, and so through our partnership, was able to get in front of some really good thought leaders. You know, success begets success, right? So as we can demonstrate one success, we're able to use that to leverage into 2 more examples, and we can grow like that. So there's that sort of geometric growth that happens that way. There's a few conferences for employer health plans. You know, you go to where your customers are.
Sure.
And you do the thing. You work the room. You bring your business cards. You shake a lot of hands. Kiss a lot of babies.
Yeah, you mentioned kissing a lot of frogs recently, and
that's a different thing.
Yeah. So that said, though, where do you see, or what have been some challenges of maybe that you're expecting or not expecting relative to the self-funded employer programs versus the insurance program?
Yeah. So I'm not known for my patience, just in general. It still doesn't move as fast as I'd like it to. It still moves way faster than commercial insurance, right? You're talking about like 25% of the time to get to a contract. And we'll go talk to people and explain to them what we do, no risk up front, no PPM, we'll do all this work for free so that you can get confidence in our outcomes. So we get to a yes, like we want to get engaged with you in the first 15 minutes of a conversation. That part has become very, very, very easy.
Yeah.
It's the papering, right? Actually transacting on the patients, actually getting involved. Every employer has a slightly different flavor for how they want to roll this out to their members, right? Do we want to do a large email so nobody feels othered? Do we want to focus on the individual families so that we can really tailor an offering to the exact people that need it? It's that's a little bit more of an art than a science. And I'm still, frankly, to be quite honest, like learning that art to a degree.
Yeah.
So that's one part. There's all these other avenues into that world that are, evolving for me on a learning basis, right? These things called TPAs, third-party administrators, the reinsurance angle, consultants and brokers, the broker consultants, right? There's so many different functions in the healthcare world and selling into the self-funded employer world that you have employers, and then you have unions under the Taft-Hartley plan. Those are very different flavors of sell, right? Very different buyers. Even though they're buying the same product, the way they buy it is incredibly different, right? So just a lot of this year we've had a tremendous response, as you know. We touch almost 400,000, maybe 500,000 lives now, and that has been from all of those early yeses, right? So we have a lot of tailwind for what we're doing and the way that we're doing it.
Yeah.
Still very much learning how to approach the broader constituency, right? How do I go talk to the Fortune 1000 in a way that makes sense for them? That might be a CFO conversation versus an HR conversation, frankly.
Yeah. And all those things are different. And I think that is so unique in that you've had the opportunity to really understand what that market is. I mean, you've been at this for 6 years now or so, and not everybody can even say that they've had any level of success in this sort of space in such a short period of time, even though, to your point, how maybe impatient you are. What do you attribute some of that to in terms of being able to, I wouldn't say accelerate that journey, but have some of these quick wins relatively early on in the company?
Well, I think you're relatively early is doing a lot of work there. I mentioned this to you the other day, but I just heard this expression about it takes 10 years to become an overnight success, and that's kind of how I'm feeling right now, right? We've been pivoting and focusing and making this product fit the market that it needs. Yeah. And now we're at a place where when we go have these conversations, like I'm saying, like the plans are so hungry for something like us that it's very easy for us to get past any sort of initial skepticism that they might have about why they would use it. So that's great. But that took a lot of time. That wasn't being able to go out this past April to my first conference and come home with about 250,000 lives. It doesn't feel like overnight success from over here. I'll say that much. But no, it's really exciting. It's really exciting. The finding the right partners to work with, people like Lena, people like Paul Romano over at Taft-Hartley, in the Taft-Hartley world, rather.
People like Brad. We have a podcast coming up with, a partner of yours. You want to talk a little bit about that and preview that?
Yeah, I mean, Brad Levy's an amazing guy. But he's not a self-funded employer, right? He runs Sophie's Choice. He's got a mobile EEG company. He also runs the Epilepsy Awareness Day Expo at Anaheim. They actually just this year, because of so much demand, are opening up another one on the East Coast. But through partnerships like that, and through partnerships like with Gabby Conacher, it's the SCN8 Alliance and Deep Alliance, you know, it took me years to create those friendships that are now able to parlay into part of the platform, right? I don't even want to talk to them as a commercial transaction, because that would diminish them and belittle them so much. But there's ways for us now where we've worked together for so long, and the trust is there. They know that what I'm doing is working. They know that I'm doing it for the right reasons, right? I'm not some random genetics company out there just trying to harvest your data. Right. I'm like, should I say their name? No, I won't. But the ability to work with groups like this at scale, you know, like when we go to Epilepsy Awareness Day, they're anticipating almost 6,000 people will show up for that. Awesome. You know, Gabi's Alliance has hundreds of thousands of families in it who we're hoping to go off and be able to be of service to, ideally through their employer. But just things like that, where we can find the entry points for people who need our service to advocate on our behalf, to encourage our customer to transact with us, right? Like, we have to be a little bit creative there, because I don't want to go spend $1 million on Facebook ads trying to get in front of the right person. That's not an effective strategy. And I think that, you know, for better or worse, the people that we are working for, the patients, are a very motivated group to see any kind of opportunity that might improve their lives happen. And if I can give them a little bit more power in that conversation, it's better for everybody.
Yeah, I couldn't agree more. Which leads me to my last question. You know, thinking about everything that you've been able to accomplish just this year. So here we are, beginning of October, just entered the fourth quarter. You know, we're painfully close to 2026. What are you most looking forward to next?
I'll tell you, one of the best things just recently, as we got through our first close on WeFunder, has been able to bring on my team full time. Right, I get more work out of them, but they've all been so bought into the mission. I mean, you talked about this a little bit early on. Like, we meet a lot of people who share our pain and are really excited about our mission. Right, so like, our mission sweeps up people as we go out and explain it to them. There are so many people who've asked me, can I get involved? And I just don't have a way, like, I don't have money to pay them until a few months ago, right? Yeah. And so my team has been amazing, because they've really been on a mission with me to, like, create a platform or go out and make logistics happen, like really rudimentary stuff. And now I get to reward them with payment, and I can go expand the team to give everybody the resources that we need to go out and be even more effective and scale. And just at the point now where we can actually have the freedom to go off and operate and go off and really do this at scale for families. And my, you know, three-quarters of my brain doesn't have to be out in fundraising mode all the time. That's honestly the thing I'm probably most excited about, is just be able to go out and get in front of customers and make new partnerships and really just do the work.
Yeah, no, that's awesome. You know, it's so cool to be a part of this journey with you now, see how far you've come. I feel like we're late to the party in terms of being able to help set up the framework and stuff. But, you know, it's really neat to be able to, you know, create this platform for you to be able to share your story and, you know, explain, you know, not just how it works, but also, you know, soon we'll be giving some of your partners that platform as well. And I think that'll be really
cool. So even just that, right? Like, being able to give a platform to people who I know that, like, every platform helps, and being able to underwrite that so that they get their voice amplified, like, that's huge, right? And I appreciate you acknowledging that you're late to the party, but I would say you're, like, just at the start of the next phase, right? So no, I'm really looking forward to it. I think these next couple of years are going to be pretty exciting.
I do too. Cool. Well, Josh, I really appreciate you joining me again today. This was really great.
Yeah, no, it's super fun. I'm looking forward to doing this more often.
All right, awesome. On behalf of CEO Josh Resnikoff, you've been listening to the Sunstone Podcast. Until next time.
Thank you.